Cardura is used alone or with other drugs to treat high blood pressure, hypertension. Lowering high blood pressure helps prevent strokes, heart attacks, and kidney problems. This medication works by relaxing blood vessels, so blood can flow more easily. Active ingredient doxazosin. Doxazosin is also used in men to treat the symptoms of an enlarged prostate, benign prostatic hyperplasia. It does not shrink the prostate, but it works by relaxing the muscles in the prostate and part of the bladder. This helps to relieve symptoms of BPH such as difficulty in beginning the flow of urine, extreme, and the need to urinate frequently or urgently, including during the middle of the night. Doxazosin belongs to a class of drugs known as alpha blockers. Indications. Cardura is indicated for the treatment of hypertension and can be used as a sole agent to control blood pressure in the majority of patients. In patients inadequately controlled on single antihypertensive therapy, Cardura may be used in combination with a vasodiuretic, beta-adrenergic receptor blocking agent, calcium antagonist, or an angiotensin-converting enzyme inhibitor. Cardura is indicated for the treatment of urinary outflow obstruction and symptoms associated with benign prostatic hyperplasia. Cardura may be used in BPH patients who are either hypertensive or normotensive. How to use. Cardura may be administered in the morning or the evening. Usual dose for hypertension. Initial dose 1 mg orally once a day. Maintenance dose 1 to 16 mg orally once a day. Usual dose for benign prostatic hyperplasia. Initial dose. Immediate release 1 mg orally once a day. Extended release 4 mg orally once a day with breakfast. Maintenance dose. Immediate release 1 to 8 mg orally once a day. Extended release 4 to 8 mg orally once a day with breakfast. Depending on the patient's symptomatic response and tolerability, the dose may be increased to 8 mg. The maximum recommended dose. The recommended titration interval is 3 to 4 weeks. If switching from immediate release to extended release tablets, therapy should be initiated with the lowest dose 5 mg once daily. Prior to starting therapy with Cardura extended release tablets, the final evening dose of immediate release tablets should not be taken. If Cardura extended release tablets are discontinued for several days, therapy should be restarted using the 4 mg once daily dose. Usual geriatric dose for hypertension. Initial dose 0.5 mg orally once a day. Contraindications. You should not use Cardura if you are allergic to doxazosin or similar medicines such as sulfazosin, uroxetrol, prazosin, minipress, saladosin, rapaflo, tamsulosin, Flomax, arteriosine, Hatrin. To make sure Cardura is safe, tell a doctor if you have a blockage in your digestive tract, stomach or intestines, severe constipation, liver disease, or low blood pressure. Cardura can affect your pupils during cataract surgery. Tell your eye surgeon ahead of time that you are using this medication. Do not stop using Cardura before surgery unless your surgeon tells you to. It is not known whether doxazosin will harm an unborn baby. Tell a doctor if you are pregnant or plan to become pregnant. It is not known whether doxazosin passes into breast milk or if it could harm a nursing baby. You should not breastfeed while using Cardura. Precautions. Cardura may impair your thinking or actions. Be careful if you drive or do anything that requires you to be alert. Avoid getting up too fast from a sitting or lying position, or you may feel dizzy. Get up slowly and steady yourself to prevent a fall. To prevent dizziness, avoid standing for longer periods of time or becoming overheated during exercise and in hot weather. Drinking alcohol with this medicine can cause side effects. Cardura side effects. Get emergency medical help if you have signs of an allergic reaction to Cardura, hives, difficulty breathing, swelling of the face, lips, tongue, or throat. Call a doctor at once if you have a lightheaded feeling like you might pass out, severe ongoing stomach pain or bloating, nervous and chest pain, trouble breathing, or repeated erection that is painful or lasts 4 hours or longer. Common Cardura side effects may include low blood pressure, dizziness, drowsiness, headache, or feeling weak or tired.